Hello everyone, welcome to my YouTube channel Dr.Akif Baig. Today we will be talking about ultra low contrast PCI. So ultra low contrast PCI is defined as when during a percutaneous coronary intervention, if we are using a contrast of less than, if the ratio of the contrast with the EGFR is less than 1, then it is called as ultra low contrast PCI. So suppose a patient is having a GFR of less than 60 or around 60. If the GFR is around 60, if we are using less than 60 ml of that, if we are using less than 60 ml of contrast, then it is called as ultra low contrast PCI. Definition of contrast induced nephropathy. So after a contrast procedure, if there is increase in serum creatinine of more than 25% compared with pre-procedure. So suppose in pre-procedure, the creatinine value was 1. Now if it has increased by more than 25%, that is by more than 0.25, within 48 to 72 hours of procedure, then it is called as contrast-induced nephropathy. Another definition is from the baseline, if the creatinine has increased by more than 0.5 milligram per deciliter, then also it is labeled as contrast-induced nephropathy. Contrast-induced nephropathy is a relatively common complication of PCI. It is accounts for approximately 11% of in-hospital acute kidney injuries. This is the third most common cause of renal insufficiency following impaired renal perfusion and nephrotoxic medication. So that is after the impaired renal perfusion and the nephrotoxic medication, this is the most common cause of acute kidney injury. So what are the indications for using ultra low contrast percutaneous coronary intervention? Is any patient who with CKD, that is chronic kidney disease, patient having cardiogenic shock, patient with who is requiring long coronary procedures like chronic total occlusion procedure, or patient with a coronary artery dissection. So these are the patients who require ultra low contrast PCI. So again, going through the contrast pairing techniques, that is in patients with chronic kidney disease, if you give more contrast, they're more likely to go into AKI, and there is a five-fold increased risk of contrast-induced nephropathy in them if you use higher amount of contrast. And also patient taking nephrotoxic medication. So suppose a patient is taking nephrotoxic medication, so they are all they may have a high chances to go into contrast-induced nephropathy. Patient in cardiogenic shock. Suppose the patient is in cardiogenic shock and there is already decreased perfusion to the kidneys. And if that patient is exposed to more amount of contrast, there is more medullary interstitial edema and cellular hypoxia. In patient with sudden coronary artery dissection, so suppose there is a coronary artery dissection. Now, if you administer more contrast to them, the contrast itself may lead to hydraulic extension of the dissection flap. So there will be increase in the extension of the dissection flap because of that. And complex coronary artery disease like procedure like chronic total occlusion and complex high risk PCIs, this is called as CHIP, where the duration of procedure is long. And if you give more amount of contrast, the patient will land into more chances that patient will land into contrast-induced nephropathy. So how do you reduce this contrast volume administration, that is ultra low contrast PCI? Is first guide catheter engagement. So whenever we engage the guide catheter during a percutaneous coronary intervention, try to use a smaller catheters, that is 5 to 6 French without side holes. And coronary calcium. So calcium in the coronary arteries can be visualized under fluoroscopy, and this can be used to locate the coronary artery ostium and can be used for guide engagement. And also by increasing the frame rate, you can identify calcium more readily. So when performing a diagnostic angiogram, try to minimize the number of projections as well. For example, if you want to visualize left coronary artery, you can only use anteroposterior cranial and caudal projections are sufficient for proper optimal visualization. And if you want to visualize the right coronary artery, you can directly take a left anterior, that is left anterior oblique with cranial projection is sufficient. Also, it is important to avoid panning and to use low magnification because the angiograms can be used as a roadmap. Using diluted contrast, you can use either 1:1 or 1:2 ratio of saline to contrast. Allows more contrast injection runs, you can give more interest, but however, this will be at the cost of expensive luminal opacification. Use higher frame rates, which may help to aid the operator to maximize visualization of the coronary anatomy with each injection. This is of particular importance if using a diluted contrast. Next, catheter flushing. This is also an important technique. Some experienced operators in ultra low dose contrast intervention Choose to remove excess contrast. So whenever the contrast is not required, some amount of contrast is always present in the guide. Always, what they do is during any, if you want to administer any drug or do exchange, catheter exchange, always remove that contrast from the guide. You can aspirate the guide so that the extra contrast cannot be is not injected into the coronaries or into the circulation. So what are the various techniques are this first is engagement of guiding catheters can be done as discussed. You can use diluted contrast injections. You can use IVUS intravenous vascular ultrasound for proper alignment and for stent expansion and everything. You can use using intravascular ultrasound can be of very much use. And wire navigation can be done by using a roadmap or uses of additional wires can be used as a landmark.